question I first wanted to address is why I'm here. You know, how is it someone with my particular background comes to this type of a forum and ends up in this environment? And I think that the story is interesting. But first, I also want to thank the leadership of SVHI and for inviting me, and I appreciate the opportunity. This has been an interesting journey for me, and when I was raised in Brooklyn and went to Brooklyn College and so on, and then went to medical school, I decided from a European background that I wanted to train like European physicians train. So after I finished medical school, I wanted to try to get a doctorate degree, but I couldn't afford it because PhD students don't make any income, and I had to pay for my tuition costs and so on. So I decided to do a residency, a one-year residency in anatomical pathology. Well, that ended up to be a 4-year exercise because it was by far the most exciting training period of my life. At that time, and this is in the late 70s, 37 years ago, followers and supporters of Albert Einstein came from all over the world to become faculty at the Albert Einstein College of Medicine. And at that point, they were already in their 80s, and some of them were even in their 90s. And they would come to, in this case, to the basement, and would train the younger pathologists like myself. And we had the European, the Austrian, Hans Popper, who wrote the book on liver pathology, Angrist, who wrote pulmonary pathology, others that wrote kidney pathology work, and so on, training us youngsters, sitting on bar stools next to the autopsy table, handling organs with their hands, because that's what they did in those days, and being uniquely observational, and teaching us what we knew and what we also didn't know. So we were really exposed, I was exposed from the very, very first time that I entered medicine into it's okay to say what we didn't know, what we don't know. But at the same time, there's a renaissance period evolving in all the different fields, particularly in immunology and neurology and neurophysiology and virology and infectious disease. So we had the opportunity to train everyone in the hospital, because CT scans just came out, but no one knew how to read them, because no one had three-dimensional slices of the human body before. So they would come down to the autopsy room. And that was the finest 4-year period of my career, but it taught me how to become a detective. And also gave me specialized training in immunopathology. So when I went back into medicine, the joke was that you didn't want me to be your internal medicine doctor because I'll want to do an autopsy. But that really wasn't my gig anyway. So, but I went to Yale, and we had the AIDS epidemic, and learned from leadership in virology and microbiology, and so it merged into more of an immunology perspective. And then in cardiology, it was the beginning, those progressive thinkers, to think about cardiovascular disease as an inflammatory condition rather than a lipid condition. So we were able to fuse those things together when I entered cardiology at Hopkins from an immunology perspective. Then there was heart transplantation came on board and so on, and then I ended up doing a cardiovascular laboratory in immunology, working with one of the leaders in the world of autoimmunity. Noel Rose was the founder of the work on Hashimoto's and the immunogenetics of autoimmune disease. Namely, 100 of us could be exposed to the same virus, and only a few of us will get sick, and a few of us will get very sick, and most of us won't even know we've ever been exposed. So the immunogenetics of this came forward and entered my realm of consciousness. When I asked the chairman of cardiology why he allowed someone from Brooklyn College, not from an Ivy League school and without a PhD degree, to enter his program, he said, "You came very highly recommended from people you've irritated." Because I would say, but under the microscope it looks like this, and this patient doesn't quite fit this pattern. They say, no, the diagnosis is this. I said, well, it doesn't quite fit the pattern, because when you get deeper and deeper, you realize every one of us is an individual. And when we use the categories of diagnoses, they're useful tools, but they are tools. They're not black and white measures of any kind. And it's not even close to being a reality for most illnesses that are gray zone illnesses. So everyone who has irritable bowel syndrome, everyone that has inflammatory bowel syndrome, they all look different under the microscope and under the investigation of true individual types of therapy. So after a dozen or so years in Hopkins, I also had experience with the transplant patients who would never get transplant because we didn't do enough of them and they had poor blood types. They had some reason that they would never get it. So that means that they would simply die. So that wasn't acceptable to some of us. So we had to investigate different avenues. So one of the things that we did was sent them to in those days, to one of the premier nutritional centers in the world, and that was the Pritikin Institute in Chicago. And then sent them to an acupuncture college that was in Columbia, Maryland. That was one of the few centers that practiced a more ancient form of acupuncture called 5-element acupuncture, the one that I ultimately trained in later on in life. And some of these folks had autoimmune disorders that affected their hearts and affected their livers and kidneys, and they actually improved and got off the transplant list. And I said, this is impossible, because these are simply needles. How could you immunomodulate someone with a needle? So I began that type of a journey. Ultimately, 15 years later, led me to want to train in it, because the philosophy behind it was pristine and natural, and I'll discuss it later. But the effects were very, very intriguing, that you could get down to a cellular level, down to an immunological modulatory level, by understanding someone's archetype and dealing with which windows to open first and in what order. And that is a profound observation. And when I described that observation at Johns Hopkins Grand Rounds in 1994, a year before I left, and I blinded the graph showing patients' immunological data before an intervention and after an intervention, showing the reality of those people getting better, having immune markers that were depressed. Then I unblinded and said the intervention was 5-element acupuncture. My chairman took me aside and said, Herskowitz, if you ever want to become a full professor here, you'll never give a talk like that again. So I stopped that type of discussion, even though I thought it was intriguing and all the people following liver and kidney patients should know about it. So fast forward to San Francisco, arriving here almost 20 years ago, I became director of a cardiovascular research institute that took me throughout Europe. And particularly we had a lot of centers, the best centers we had in the world doing research in cardiac surgery were in Germany. And whenever I went there and I walked around and I went into pharmacies, I realized that the pharmacists were not like our pharmacists. They were homeopathists, they were herbalists, they were naturopathic trained practitioners. And the stuff that they gave me worked. So it opened up my consciousness to the reality that I had never been exposed to before. Coming from a purely academic environment and not exposed to this, and opened up the possibilities and kept in my memory. After running this foundation and getting into an argument with the board of directors on whether or not we were to try to prevent people from needing cardiac surgery versus knowing how to treat them following cardiac surgery, me and my wife decided to do something more on a global level, and we co-founded the Institute for One World Health with the vision that we would create a nonprofit pharmaceutical entity that would do work in neglected diseases and rare diseases. When George Bush came into power, we realized that we couldn't do all the diseases we wanted to do because women's health was at the top of the list. And we didn't feel that that was a good thing to start a new organization with. And so we decided to focus on neglected diseases of the developing world, of the impoverished. And took it forward and ultimately got large-scale funding from the Gates Foundation to do this. And a one-year exercise turned into 8 years. And that took me throughout Asia and absorbing the different traditions in India, Bangladesh, Nepal, Thailand, Vietnam, Taiwan, Japan, throughout that part of the world, exercised again, expanded my consciousness even further. So when I left the global health space in 2009, I realized that in the global health world, we were focusing on things like cholera, diarrhea, and malaria, things that we don't have here. And yet, as those economies will grow, they'll have the same diseases that we have here. And so global health in the future, even in that part of the world, will become the same type of health that we have to deal with here. So I wanted to pursue what I would consider a vision for the future of medicine. And that's where I come today. So 4 or 5 years ago, I knew no one in the Bay Area in integrated medicine. I had no idea what even the term really meant, because it still is unclear to me what the term means. And so I decided to call it something different, because my own vision was to use the different traditions and say the hypothesis is that the level of toxicity that our systems are exposed to today is too great for any one single tradition, whether it's functional medicine, naturopathic medicine, homeopathic medicine, any individual form of medicine would be able to handle. And so I called it convergence medicine, and wrote a single page on Wikipedia, and there it goes. I mean, that's what it is today. And ultimately, I want to share that experience with you today. But having said that, I wish I had met Bert years before then, that we would have expanded my horizons and expanded the...
No, I just gained this today.
Yeah. So, here we go. This is from my colleague at Johns Hopkins, who clearly, to me, had then become, over time, the most famous cardiologist in the country, running all the mega trials. Dr. Tobel is now head of the genetics arm of the Scripps Institute, and is now a more expansive thinker in terms of medicine today. And this is, I think, a very accurate quote. Dr. Brawley is an African-American physician who works out of the public hospital in Atlanta, the largest single public hospital in Atlanta in the United States. And he was, when he wrote this, he was the president of the American Cancer Society. And that was intriguing to me, that he had the nuts to do this, and he did, and he wrote this lovely book. But the concept is again becoming, some leadership are not afraid to discuss this in an open way. But some 250 years ago, this quote from Voltaire was is a fairly negative statement, but to a certain extent it has some truth to it. And the reason it's all coming to a head today in this particular communication between myself and the audience is because we clearly live in experimental times, and the discussion that we had earlier in terms of EMF exposure and so on is just one of the many different variables that have now been exponentially increased over the last few decades. And so we have a longer and longer list of stuff that our systems have to be accustomed to and be able to excrete and eliminate and metabolize. And the list is unfortunately not going to shorten anytime quickly. So what I want to discuss and enter into a dialogue today with everyone is a strategy, a strategic approach that one would have to think through. Some of it is already well known to this esteemed audience, and some of it may be a bit of a different perspective of the same topics that you think about every day. But I also knew that some of my own patients would be here this evening, so I wanted them to get a good flavor as well. So that's the exercise I want to go through. As Robert said, we have trillions of cells. I really don't know what the correct number is. I don't think anyone has a clue, but there are certainly many, many cells, okay? Whether it's 100 trillion or 5 trillion, I don't know. I don't know if that makes any difference. And of course, this leads to a tremendous level of complexity. But I want to entertain tonight that we as an audience collectively, we cannot fathom the level of complexity. We simplify the level of complexity all the time, but the level of complexity is mind-boggling. And I'll be able to, if we had a video, I'd be able to show some things to you, but we don't have access to it. But we'll get into it. There are 12,000 medical illnesses in our databases today, and we know that over the last 30, 40 years, a certain portion of them have risen exponentially. Whether it's autism, as you all know, autoimmune disorders, immunological disorders, inflammatory disorders, metabolic disorders, they're exploding in prevalence. And the question is why? And of course, you go back to these experimental times, and you can come up with a reasonable set of hypotheses that we're not dealing with this new experimental time very well, because we haven't had a chance to adapt to it yet. We haven't had a chance to strategically address it in a coherent and comprehensive way, nor have we been able to teach anyone how to deal with it, and nor are we able to even address it ourselves and communicate it intelligently within our own communities. And I'll address that later on in the talk. So if you want to take this particular diagram, it's hard, you don't have to see the writing on it. This looks like an Intel circuit, but this is representing about some 11,000 pathways known within an individual cell. So this is now repeated 10, 100 trillion times in the system, and then it interacts with the extracellular space. So this level of complexity and the miracle that this thing functions even when we're ill is pretty mind-boggling.
Yes,
That's
that's
fine.
good.
That's fine.
That's good.
It's just we don't need to see it. So here we have, in my opinion, some of the concepts. If we look at things on a system level without necessarily thinking about things as a subspecialist, whether it's cardiovascular or rheumatology or gastroenterology or neurology, looking at it in terms of biological systems, we know very little about the immune system, metabolic, digestive, or elimination pathways. Thank you so much. We know a little bit more about these other functions here, and we think we understand the easy stuff. The easy stuff is on the cardiac side is simply plumbing or the pump, and the filtration side, the kidneys. And I think that these are the two best understood systems that we currently have, because they're somewhat mechanical and understandable when you analyze it. But how do you mine the vast numbers of data points? Well, as Dr. Topol is in charge of this digitization of medicine at the Scripps and at the national level, he's preparing us to think about the use of artificial intelligence, taking all of the continuous data streams that we will all collect on our iPhones in the future, collectively put it into a mass set of databases that will look at natural history of all of our daily lives. And as we get more sophisticated, not just measuring pulse, but measuring all the different metabolic functions on, whether it's on our iPhones or on our toilet seats, which the technology, the cutting edge technology, of course, comes from Japan, because people like to know exactly what they need to do there as soon as they pee in the morning. So, but how does one interpret all this data? And right now we're limited to clinical trials, and these are the arguments that are made against alternative medicine, that you guys don't do placebo-controlled, double-blinded trials. And I'll explain why that's nonsense, relatively nonsense, because the trials are designed very, very intelligently. And the drivers of disease are poorly understood. This ultimately is the reason why the pharmaceutical industry is now failing in productivity. Because when I trained in cardiology, the number of new molecular entities at the Food and Drug Administration were twice as high on an annual level as they are today. So productivity has decreased some 50%, and I'll explain a little bit about that later. But as that system, which hypothesized that we knew more than we did, and bet the farm on technology that would robotically, exponentially be able to screen